At the beginning of the coronavirus outbreak, only 3 African countries, South Africa, Cameroon and Ghana, had laboratories with the capacity to test samples for the deadly virus. A collaboration between the Africa Center for Disease Control and Prevention, Africa CDC, the World Health Organization, WHO, and African governments has changed this state of affairs. Now, 21 laboratories in Africa have the ability to test for COVID-19.
Diagnostics is the cornerstone on our ability to rapidly detect and rapidly respond.
The trade links between Africa and China have put the continent at a greater risk of the virus spreading into the continent. African airports, like the rest of the world, have introduced mandatory checks and screenings for all passengers entering their territories. Over the past 2 weeks, the WHO has held trainings in Kenya on detection of the virus for airport personnel. The WHO has identified 13 priority countries.
The full week is mainly focused on the countries which has a lot of interaction with China, a lot of travelers or goods coming from China, or they are located as a hub for the international travelers. So we have identified 15 countries. We got other requests from other countries to be included and with high priority. So I think the total number of the countries being trained during this week is 18 to 20 countries, mainly the big international air hubs in Africa.
The idea is to, as much as possible, keep the virus from entering the continent due to Africa's inadequate health infrastructure and personnel.
The training this week is mainly for, to strengthen surveillance at the point of entry. So we have a profile of participants from Ministry of Health, from also the airport, and then the civil aviation.
It is to remind them of the state responsibilities, the state preparedness to deal with any communicable disease imported through the air transport.
Crucial because of the close economic links between Africa and China. There are currently 8 direct flights daily between African countries and China. At the moment, African national carriers, including Kenya Airways, Egypt Air, Rwanda Air, and Air Tanzania, have suspended flights to China indefinitely. Only Africa's largest carrier, Ethiopian Airlines, is still flying to China.
We have Chinese coming from China to Cameroon. We have Cameroonian students living and studying in China. We have businessmen who go to China to buy goods and come back to Cameroon for sale. So I think that even if we don't have that much interaction as other countries, there is traffic between China and Cameroon that should warrant us to take measures for prevention and maybe respond if any case happen to be detected in Cameroon.
One is recommending that we close the borders neither for travelers nor for goods. So if some airlines or countries are closing the borders, this is like a decision made internally, but not according to any recommendations from our side.
By Tuesday, China had reported over 1,800 deaths following the deadly outbreak. Sarah Kimani, SABC News, Kenya.